I'm Dr. Natalie Marks, and we're here with another quick cup of knowledge. Today, joining me is Charli Dong. She's a boarded veterinary dermatologist practicing in California. Dr. Dong, thank you so much for joining us.
Thank you for having me.
Absolutely. Well, we're really excited to have you today because as a dermatologist, you've got a lot of insight talking at the conference here about things we didn't learn in school. And I think a lot of us graduating, we get onto practice and we think we know what we're doing, and then all of a sudden we get into our first job or our first case, and all of a sudden our mind goes blank and we think, what did we learn? So share some of the insights of what you're going to be talking about in that lecture.
Well, there were so many things I wanted to talk about in this lecture because there's a lot of things we didn't learn in vet school.
Right.
But I did limit it to diseases that you might see and you can visually either diagnose, or that it may not look like what it looks like in real life compared to the textbooks.
Okay.
So something that you can easily identify.
And that's not something just for the veterinarian, that's also for the technician who's assisting in a lot of the diagnostics as well.
Yes, that would be helpful for them too.
Great. Well, I'm sure that's going to be a lot of good insight in that. You're as a boarded dermatologist and a specialist, I think we oftentimes in school think we don't really know if we're going to specialize or not. We might go into practice and stay there, or we might do an internship and think about going into a residency or specialty. You have a really positive view on your specialty and being a dermatologist, and I think it's really helpful in today's industry where a lot of people are talking about well-being and staying positive and having balance in life. I'd love for you to share some of the positives about your specialty and why it might be interesting for others to consider.
Well, have you ever met an angry dermatologist?
I have not. A very good point there.
Yes, we have a great lifestyle. Usually we don't need to work weekends, and there's no real derm emergency. Yes, a dog is scratching at 2 a.m. or if there's a really bad ear infection, but no urgent matter that we do have to rush into the office. So time and schedule-wise, it's really good. Also, I get to see the best of the clients most days. So your general practitioners really help us out, kind of screen through the clients. So by the time I see the clients, they usually want to try everything that I offer them.
And that's wonderful. Yeah. And so with those referring practitioners, what are some tips that you can give to them to help set up this team approach between the day practitioner and the specialist to be the most successful as possible?
I think communication is most important. So I'm always happy when general practitioners want to call me up and say, hey, I'm going to send a case over, what should I do ahead of time? Because each case is unique. And so I do want to say general things, but at the same time, we want the best for each patient. So I do want a tailored protocol for each client.
So if you had a practitioner who called you up in regards to, let's just face it, an allergy case, right? I feel like that's what we sometimes struggle with the most. Do you want that practitioner to be doing all the baseline diagnostics at their practice, or do you prefer for them to go directly to you?
It depends on what their comfort level is. General practitioners can definitely do a lot of the diagnostics. And so ideally, I don't want to wait till they've been itching and scratching for 10 years, but either like a really young animal, so we can start them on immunotherapy as soon as possible, because immunotherapy can do great things. It's not a medication. It's the only thing that we can be proactive about the immune system.
Wonderful. So as a dermatologist, and I love, have you ever met an angry dermatologist? It really should be a t-shirt for you guys. You've got a lot of positives in your specialty, but you're also a new mom, right? Which, congratulations.
Thank you.
And a lot of the profession is female, and a lot of us, including both of us, we're working moms.
Yes.
And that's a whole nother level of challenge in life, right? But you mentioned there's obviously a lot of strategies that can help, but one outlet that you found that's been really helpful, if you wanted to share with everyone.
Yeah, there's a Moms with DVM group, and that has really helped me out. In any questions, there's no judgment. Any time of day, if you want a laugh, if you want to learn something, it's a very helpful Facebook group.
And it really does take a village, doesn't it?
It does.
Being
it does.
a working mom.
Yeah. It's nice to know if someone is enduring the same things you are, or if you're having a down day, you're not the only one, and that has really helped me out.
That's wonderful. So as a dermatologist and as a specialist, is there anything that has been a challenge for you with clients? Because I think a lot of our profession has been struggling with online reviews, right? A case goes wrong and a client makes an online review, and it's devastating to a lot of us. Or a client that maybe comes to you and isn't as compliant and then gets upset that the strategies aren't working. What would be a common client challenge that you have? Because I think a lot of us listening would really want to know how you might overcome that or how you deal with it.
That's a very good question. Certainly as a specialist, we still also have difficult clients. I would say the biggest thing is setting expectations, especially on the first exam. I tell it to them straight and I say, honestly, if you do everything I ask and it is more laborious if you don't want to pay, or mainly I get at what is their goal and how they plan to achieve that goal. So is it like a time schedule issue? Is it a physical issue, they can't bathe their dog, or financial? So we try to help them out the best we can.
And it sounds like those would be good talking points for a graduating student, right? Who's going out into practice and starting out in derm cases, how you want to be talking to clients and setting them up for success.
Right, yeah. Especially in school, they tell you, okay, you need a diagnostic workup, you need to do A, B, and C, this is the only way to do it, and steroids are very bad. But in reality, that's, we can't do everything by the book, and some of the patients, they don't show up like what the book describes.
And with those allergy patients, specifically food allergy patients, I think food allergy trials right now can be a 2-hour political conversation in themselves, right? With clients who want to be doing over-the-counter diets and homemade diets and raw diets and you name it, the gamut. When you're counseling clients on food allergy trials and they say they really want to do this over-the-counter food, because we get this all the time in day practice, what do you do to convince that client that that might not work and your recommendation really will get to the root of the problem first? What are some strategies that work?
That's a very good question. So I always say, if you've ever bought a chocolate bar that says doesn't contain nuts but made in a factory that does, well, the veterinary diets, they clean out the entire lines, and they also have checkpoints to see if they have proteins in those particular checkpoints, such as like the delivery trucks or the factory. So that's what we're paying for. And also, I also compare it to peanut allergies. So I say, okay, well, the top allergies are chicken, beef, fish, lamb, and dairy products. And even though a lot of dogs are allergic to chicken because it's in a lot of foods, doesn't mean everyone who has allergies is allergic to chicken. And even a small amount of those peanuts or chicken can cause a big flare. And so usually when I can compare it to a human disease, it makes it easier for that client.
Those are great pieces of advice.
Yeah.
What pieces of advice would you give to a student who's graduating who, listening to this, might be like, this sounds like an awesome specialty. How do I start my path to become a veterinary dermatologist?
Well, I definitely encourage people to explore the different specialties and also do a rotating internship if you can, and visit as many practice hospitals as possible, even if you're going for a week or 2 visits. I know vet school is really busy, but this is the rest of your life. So, and once you commit to one specialty, you better commit to it, because it's another 3 to 4 years of your life.
Yeah. Well, again, congratulations on your family and your success in your specialty. You've given us lots of good feedback and pearls to take home, both in practice and also for advice for future dermatologists. And I really thank you for your time. Best of luck at the conference.
Thank you
for joining us.
And thank you for having me.
Thank you.